Okay, good evening to everyone.
Hello, good evening.
Yeah, nice to meet everyone again in our live. Yeah, today me, Dr. Jeff, and
And I'm Dr. Melissa here.
yeah, we'll be
So,
speaking in English.
yes,
This round different a little bit. Last two sessions we were talking about in
in
Mandarin.
Mandarin, yes.
Why
Okay.
English? This round
Because today's topic is actually very common, and
very
we would
common.
like to share it with more of our different race of friends.
Special request from
Yes.
client. Yeah, so we want to let more people to
Know
listen to
more,
know
yes.
more. Yeah, and our topics today is rather generally more common.
Mm,
It's about acne.
yes.
Okay, pimples. We call it pimples,
Mm.
acne, ataupun Melayu kita panggil jerawat.
Jerawat, yes.
Yeah. So it's a very common skin issue that frequently affecting young teenagers.
Yes.
Yeah. So
Teenagers, adolescents.
what we want to talk about today?
Why is acne treatable?
Okay, is acne treatable? Most of the time, people will say acne may not need to
Yes, yes, yes.
to really treat. It will heal
Yes,
by itself.
yes.
But why we need to take action? Yeah. So something that we need to look into it so that we can understand better. Most of the time, as a parents, we are dealing with our children. They may be having
Kids.
acne. So, but we don't know really what should we do as a parents. Yeah. So if you are a parents, so probably today's video will let you understand more about your children's acne. So maybe you can help them to tackle their acne in the proper timing so that you can help them to have a better skin, and also better outcome. So first of all, Dr. Meza, can you tell us what is the common age of teenagers having acne?
Okay. So actually, acne starts appear during after puberty, but the peak age is actually between 16 to 20 years old.
16 to 20 years
Yes,
old. Is it same
16.
for female and male?
Yes.
Okay.
Yes.
16 to 20 years old, everybody. So take note, if your children is reaching this age, 16 or 17, 18, okay, if they are popping out acne, means they are having a teenager acne.
Yes.
But my question is that possible to have acne even before 16 years old?
Yes.
Yes.
That's why I say it starts at puberty. Yes.
Mm.
So because
As,
of our hormonal change after puberty.
as early as how young it could be?
Okay, so for female, actually our menarche or the age that we started to have menses can be as early as 10 to 11 years old nowadays. And for males will be about 13.
Around that 10, 11,
Yes.
12. So basically the youngest patient we ever see to have acne pop out, even a severe acne pop out as early as 10 years old, 11 years old. Recent news reported that our human beings are getting puberty as early as 9
Yes.
years old.
Yes, yes,
Yeah,
yes.
9 years old already having menses, already having a puberty changes.
Mm.
Last time, 10 years, 20 years ago, the puberty average age was about 11 to 12.
12, yes.
Now 9 years old, imagine.
Mm.
So as a parents, we need to be very sensitive to this kind of changes.
Mm.
Our children could be like having their puberty in an earlier age. So they may be having acne in their earlier age, then we need to understand how to help them to deal with it. Yeah. So if having acne, in what kind of scenario, okay, we need to take action.
Yes, because last time my mindset when I was a teenager was like, acne is actually part and parcel of becoming a teenager. So there's no need to seek for treatment. But nowadays, because I see a lot of patients with acne, they're having issues such as confidence level drop,
No confidence.
depression.
Okay, yeah,
They
yeah.
don't dare to mix with their friends. Their social life is all become haywire because of this acne or this figurement issue. So actually, the main issue here is actually acne, severe acne with acne scarring. That's the most troubling thing for them.
Actually, every one of us will ever had some experience during our teenager age to have some acne. Yeah, even myself also, I had my acne about 18 years old. All of a sudden, my face suddenly popping out of acne, and I don't know what happened, and it just keep on popping out. Yeah. So, but luckily, sort of like it resolved about after a year. But it definitely, if we look closer, it leaves some marks.
Yeah.
Yeah. So nowadays, acne becoming more focused, more important for us to pay some attention because definitely now children are more self-attentive,
Self-conscious.
self-conscious. They want to look good. A lot of this important focus or priority on self-image. So preventing scar is rather important. Now is a lot of people starting to aware that it's important features to
Tackle.
tackle or to bear in mind when we are dealing with acne. So maybe Dr. Mesa can share with us what are the factors or characters of the children's acne that probably making them a risk of having scars.
Okay.
Yeah.
Yes, yes. So that's a very good question. So actually, acne scars that are very prone to acne that are prone to become scarring or live-on scars. Actually, those with very big pustules,
Very big,
papules. Yes.
bulky one.
Yes.
So if your
Okay.
acne pop a lot big one, important form
Yes.
scar, very high risk.
Yes.
Second,
Number two, the coverage or the location.
okay,
So if the coverage or the location is very widely spread,
very near to each other,
yes,
a lot
very
congested,
congested,
all
yes.
together, small, even though it's small,
Mm.
then the risk of scarring is higher.
Yes.
How about
Okay.
the location you mentioned? If it is on the forehead here,
Forehead, temple here?
temple,
Yes.
the skin
Cheek.
here, the cheeks, the skin here tends to form scars easier.
Yes, yes.
Okay,
I find
it's number
that.
two. How about age?
Age, yes. If your acne or your severe acne happens earlier,
Earlier, before
yes.
16 years old, as early as maybe 12 years old,
Yes,
11 years
it
old.
started 12, 13.
Yeah, anyone who have acne earlier before 16 years old, the longer you have your acne, the more repetition of acne
Injury
injuries.
over the skin
Yeah,
area.
so that actually over time accumulate and form scars. So number three is the age factor, the factor of age. Anything else? Number four,
Mm,
if a patient have tried products,
mm.
somehow rather controllable but still popping out acne, is there a risk considered as a risk to form scars?
Yes, okay. So if a patient has been trying out different products, there are actually some harm or injuries already happening over the skin.
Okay.
Okay, so if she also has acne breakout over the same area, so it can form scar.
What you mean is, if the patient has been trying the product, sometimes the product for acne could be quite harsh to the
Yes.
skin. It could be quite drying, quite sort of irritating on the skin. Yes, it helps to resolve the acne fast, but then the harshing ingredients of the products may damage or weaken the skin barrier. And the acne, if it is still popping out again after it is resolved, that the repetition of injury can form further damage on the skin structure, and over time it will form some scarring on that. Yeah, so this is the another factor that we also look into consideration as to determine a person whether they have a risk of scarring or not. So this is number 5. And from my experience, okay, a lot of children who have heavy acne, they tend to have some itchiness, scratches, or sometimes they even go to do some extraction treatment as part of the belief to
Yes, yes.
extract to reduce the acne. And indeed, by facts, this method is actually can further aggravate the damage on the skin and slowly forming scars without knowing. Scars of acne doesn't form immediately, even though sometimes if you try products, if you try facial treatment, it may resolve. You looks good, yeah, you feels good, but the acne resolved at that particular time doesn't mean the damage is gone. The damage could be already established at the same time when you did that treatment to resolve the acne. So that damage will stays on, and over time it will form scar 6 months, 9 months, even 2 years later. So this is the things how sometimes we can't really realize that the acne can form scar. So the priority to treat acne here is actually to determine right far before the acne get worse, to determine all these factors whether you are on the risk of forming scar. If you are, take action as early
Earlier.
as possible,
Yes, yes.
then you can really reach the full or the best curing, right? Okay.
Yes.
So let's say like a person really not yet. Today after they listening, wow, feel scared. Wow, but they just early, maybe 2 months starting to have acne. Okay. Are they supposed or anything that we can share, yeah, to let a
Yes.
lot of, more people at least do some care to prevent their acne?
From getting worse.
Yeah, maybe from lifestyle, any particular things from lifestyle, from food.
Yes.
Yeah.
Okay. So definitely from lifestyle, because we understand that some of the lifestyle factors such as lack of sleep, gut issues, or hormonal, especially females who have menses every month, and also diet-wise, high sugar processed dairies can actually trigger or make our oil glands more sensitive to the hormones fluctuations. So this can actually trigger off acne breakout. Okay, so from lifestyle wise, we can help to actually reduce our high sugar food, try to reduce sugary stuffs and also dairy. Okay, and number 2 is actually manage your stress wisely. You can actually practice some deep breathing exercises, do some yoga, or try to relax yourself. Find some hobbies that you like to relieve the stress. And then, other than that, for females, hormones, we can't change anything, right?
Okay. So let's recall a little
Mm.
bit. I think Dr. Marisa mentioned a few important points just now, something about food. What are the foods that a person should try to avoid, especially during the breakout, especially sugary food and dairies?
Dairies.
What are the examples?
Okay.
Like sugary food, yeah, is it all sweet thing cannot eat? Mango can eat or not?
Cannot.
Cannot, mango,
Cannot.
okay.
Okay,
How,
so the high sugary or sugary food are actually those with high glycemic index.
glycemic index,
Yeah,
okay.
GI, high
Means
GI
the
foods.
food can spike up our sugar very fast in the body.
Yes.
Those food are usually sweet and less in fiber.
Mm.
So fruits including like mango, watermelon, banana, no,
Dragon fruit,
dragon
banana,
fruits,
yes.
okay, banana,
Yes.
a little bit okay, but not too much. Prefer
Grapes,
grapes, okay. Grapes also don't
very
take a lot.
sweet, yes.
Okay to take food. Apple, okay.
Apple, okay.
Orange,
Orange, citrus, okay.
citrus, okay. Guava,
Guava, yes.
durian cannot.
Durian cannot.
Durian, okay, you
Cannot.
can take maybe a little bit lah,
One,
okay,
one.
yeah, 1 or 2 lah, okay, if it's your favorite, all right.
But
So
not during your breakout.
yeah,
Can
try to
actually trigger.
reduce during the
Yes.
breakout the usual time. If it is during your menses timing, then you feel more breakout during your menses, then try to avoid those food during that time. Okay, then if it is normal timing, then you may enjoy a little bit more. What dairies? What are the example of dairies that cannot be taken?
Okay. So the examples of dairies are actually those processed dairies.
Processed dairies.
Yeah, such as cheese,
Cheese, ice
yogurt,
cream?
ice cream. No,
No,
cannot.
bakeries.
Bakeries, no.
No. Okay.
Okay.
Cheese cannot.
Cheese
Pizza.
cannot. Pizza,
No.
no.
Okay. Fresh milk.
Fresh milk, okay?
Okay. Fresh milk.
Good.
Okay. Yeah. If it is yogurt, plain yogurt,
Plain Greek yogurt,
Greek.
okay,
Okay.
good.
Yeah.
But no, but not
Not
those
sweetened.
flavored
No
one.
flavored.
Ah,
Yeah.
not
Okay.
with fruits one.
So I think these are some guides for us to
Mm.
look into our usual routine foods that we are taking. Yeah. Can drink bubble tea or not?
No,
Maybe
not.
bubble tea, yeah, try to cut down. It's one of
Yes.
the proven factors can trigger the acne. Yeah.
Mm.
Okay. So besides this food, okay, how about skincare products? Anything can aggravate the acne that we can try to avoid. Can we put sunblock?
Sunblock, yes, you have to.
Yes. Yeah.
Okay.
But can we do makeup to cover acne?
Heavy makeup, no.
Why?
Actually, it can actually clog up the pores and make
Clog the
your
pores.
acne worsen. Yes.
But how about if I put, then I wash, I put makeup remover, I wash, isn't it still doable?
Uh, it will still leave on stain and you can't really clean it off completely
Yeah.
with makeup removal.
Okay.
Yes.
The reason here is because when the skin is oily and congested, actually the oil glands will produce overactive producing the oil gland. You will have some sebum material which is sticky in character. So this stickiness actually just underneath the skin, which is in our epidermis and epidermis layer, which is just very surface. You don't see it, but actually it's just exposing on the surface. So when you put on makeup, concealer, those materials from the makeup can stick on with these sticky materials from the oil gland. That's why it can clog your pores and become inside. Maybe one time, two times, you don't really feel it, but over time,
What are the kind of products that you would suggest to our acne-prone skin patients?
okay, let's say
How
if a
to choose,
patient
yes.
starting to have acne, so most of the time the understanding is we need to know our skin is changing. Yeah, definitely when we are going through puberty, our skin is changing from a childhood towards adulthood kind of skin. So oil glands starting to become matured and
Active.
is starting to become active and producing oils. And at this moment, what you appreciate that your skin not only oil, but the outer skin layer becoming slightly weaker. In the sense, it become drier, it become not so stable. Yeah, you will feel that it become a little bit sensitive, which means that whenever you contact with like certain irritation, either very hot, very dry, or very cold, yeah, extreme weathers, it may triggers up your acne very easily. So these are the changes going through. So what you need to bear in mind when you use a skincare is actually to help the skin to keep the balance back. So the balance is where your skin need to have lesser oil and more hydration on your outer protection layer. Because what your skin is having changing is oil becoming more, the outer layer hydration becoming less. So you need to balance it back by reducing the oil and increasing back the hydration. So the common usual products that we are using are four methods and four steps: cleanser, moisturizer or toner, then cleanser, toner, moisturizer, and sunblock, right? Okay. So cleanser basically the works is just to cleanse the outer layer. Don't bear your idea as in to cleanse your oil. If you assume that the cleanser is cleansing your oil, it actually dries up your skin even more. So the logic is by using the most mildest cleanser, not really foamy, just enough to give a cleansing on the outer layer, and use it as less frequent as possible if you are not really always at a dusty time, dusty area, or a lot of this dirty environment. Just cleanse once a day, okay? And then use a mild oil control solution. Usually it can present in the essence or tonic form, so that you apply. Usually the content that you can choose as mild oil control, are like tea tree or lactic acid,
Mhm.
tea tree or lactic acid. Okay, yeah, you can take a note. Okay, so these are the mild oil control ingredients that control the sticky materials of the oil gland, and yet it doesn't cause additional dryness at the outer layer. Very crucial, because we need to control the oil, because oil is deeper side, but while doing the controlling the oil, we don't want to dry up the outer layer. The idea is to try to, without harming the outer dryness, the outer epidermis, so that it doesn't get dry. Same goes to the cleanser just now. It doesn't dry up the skin, just cleanse, then use a toner or essence to reduce the oil. And then only after that, third step, you put a water-based moisturizer and water-based sunblock. Okay, so this is the tricks to get your skin balanced. So any one of you, if you are facing with this acne scenario, or any one of you is parents, so if you are having your children having acne, so these are the guide for you all to understand the principles to choose the right products for your children. Yeah, so it's not what brands matter. It's actually what principles or what kind of characters of skincare that you are using for your children or for yourself if you are having acne. Yeah. So this is the basic principles based on fundamental biologic characters of the skin to tackle or to balance the skin. Yeah. Not necessarily have to do a lot of treatment, lasers, facial extraction. That actually aggravating the acne. Yeah. A lot of parents or even my clients' experience is they, once they have acne, they may start to have a little bit worried. They will start to go cleansing in the facial treatment. First few sessions, it looks good, fantastic results, cleanse and everything goes. Then you will feel that, oh, there's a solution. But ultimately, and in fact, after you gone through a certain period of session, the treatment doesn't work anymore, because the first few sessions, it actually works because your outer skin layer is still quite strong, but because of this treatment extraction, it actually damage your outer layer of skin without you knowing it. Yeah, but at the same point, it actually can reduce your oil gland and reduction of your congestion. It's good, but the outer layer has already weakened. So if the acne break out further in the future, the extraction treatment is not more working because the outer layer become weakened, becoming very dry, becoming very weak. Yeah, then your acne will aggravate even more than before. So this is the facts that a lot of people don't realize. Yeah, and then they are facing these kind of difficulties to deal with the acne. So most of the time, just taking care of your skincare principles, right? And try to avoid using facial extraction as a method, that usually you will see more stable results.
So to simply put, actually, when you choose products, you have to choose this wisely. You can choose those with a non-comedogenic, oil-free,
Yes.
water-based, or suitable for oily skin. Okay, so these are the kind of products that you should choose, and then avoid extraction, like what Dr. Jeff mentioned. And you can choose milder form of facial, such as microdermabrasion.
Microdermabrasion, yes. Or now a lot of people will use just a suction manner, a modified manner of microdermabrasion, which means you do suction and liquid flow that actually cleanse the pores, and that actually the solution and suction can be more effective to reduce the stickiness part of the congestion, but it doesn't harm the outer layer. The idea actually fall into the same principles again and again, regardless how severe is your acne. So if your acne is mild, then you should be able to take care well with those principles of skincare and also some lifestyle, some food. Sleep good, sleep well, don't sleep late. Get yourself more relaxed by keeping your healthy routine of your sleeping cycle. Don't sleep late, that will be easily aggravate your stress. Then if your acne still couldn't manage very well with these methods, then it's the time for you to sort for a doctor's consultation and treatment. Of course, there are some medication to treat acne or more severe acne. So the purpose, because if you can't really take care of your acne well with this method, definitely your acne is on the less controllable manner, and the
more
risk,
stubborn type,
the risk of scarring.
yes,
So the
also
purpose
higher.
of a doctor here is to come into intervention where or to prevent scarring, and take action to treat or cure the scarring as in the early phase if possible.
Yes, so medication is actually one of the way for those severe acne and those with high risk of scarring. So Dr. Jeff, I also come across patients with acne, severe acne, and also with some irregular menses, hormones haywire. So how can we explain that? Can we just treat the skin?
Okay, yeah. So this come with this issue of hormonal triggered acne. Yeah. Especially now we are talking about this is more related to just female, because females hormone characters are a little bit more complex. It's not saying or very difficult to understand. It's not. It's very simple to understand. But just that the behavior of the hormone involve three hormones. Yeah, men involve one hormone, female involve three hormones. So the interaction of these three hormones definitely will become more colorful, more pattern. So that's why hormonal trigger acne tends to occur more in female, because if you have three hormones, the interaction of these three will become haywire easier than just one hormone, right? So if a lady, especially young teenager girl at about 16, 18 years old, having irregular menstrual cycle, which their cycle doesn't go good flow, sometimes have, sometimes don't have, sometimes very heavy, sometimes very frequent. Yeah, definitely it is a sign to say that this female or this teenager girl is having irregular hormones, which may relates to underlying character of, we call it sensitivity to estrogen or estrogen sensitivity. It may be a subset, a small portion of presentation of this. We call it PCOS, polycystic ovarian syndrome. Okay, most of the time when the girl having this underlying genetic tendency of this PCOS, it doesn't present as PCOS. PCOS is where if you do a ultrasound scan, you will find that multiple unmature cysts in your ovaries, which that your ovaries couldn't produce the ovum, the eggs. So if the ovum is not produced, multiple cycle of the ovum being accumulated in your ovaries, then it become a ovarian polycystic ovarian syndrome. Okay, so this is not a kind of really severe disease, but it's a kind of characteristic of hormone behavior in a female. It tends to occur about 20 to 25% of females categories. And among this group of ladies, they may present differently at different age of their life. So as early as about 16, 18 years old, when they're starting to kick into their puberty, this hormonal cycle, hormonal characteristic of PCOS or insulin, call it estrogen sensitivity, was starting to present it out as a character of acne breakout. So insulin resistance is underlying character, PCOS is a presentation, and the real presentation of acne is related to, we call it estrogen sensitivity. Yeah, so it looks a little bit complex, okay? Yeah, but don't worry, what you need to know, okay? Just saying that if a gay girl having irregular menses
and severe
acne, okay, so definitely she is probably on the category of this hormonal imbalance characteristic, which may be underlying PCOS. But what you need to focus on is try to cut down the estrogen sensitivity, which is the factor that causing the acne, by tackling the underlying insulin resistance. Okay, so that's why it goes to the fundamental, which means that you need to take care of your food, take care of your sugar, cut down the dairies, take care of your gut health. Okay, that will reduce the underlying factor of this insulin resistance. So by doing so, you will be able to help your hormone balancing easier to take care. Yeah, the insulin resistant one is reduce your estrogen sensitivity, which triggering your acne part also will reduce easier. Yeah. So by doing these two, not only reducing your acne breakout and control your acne easier, your menstrual cycles could be also improved indirectly in this manner. And we know that PCOS character is an underlying born genetic, so you can't really cure it or sort of get rid of yourself, but you can control the aggravation of this presentation by doing the same thing, taking care of your diet, cut down the sugar, cut down the dairies, yeah, and take
Improve
care
the
of,
insulin resistance.
yes, you are right.
So to simply put, actually, patients with PCOS, such as those with acne and also irregular menses, they have to tackle the root cause of the problem. So no, not just purely the skin treatment or skin medications. So you have to tackle the insulin resistance and the hormone sensitivity as well. Yes, to actually address the concern more effectively.
Yes. Maybe some people will think that, oh, then if it is hormonal related, the treatment, is it a hormone treatment?
Yes.
Yeah. So basically for acne during teenager, we try to avoid using hormonal treatment method because on one hand, it may carry some worry about hormonal disturbance, means if you take hormone pill, it will disturb the cycles of your own hormone. Then your growth during the puberty may be disturbed. So even though it is proven safe, and if you take it for just short period of time to regulate your menstrual cycles or hormone, but of course it still bring a little bit of worries, yeah, to a lot of concern to a lot of publics and a lot of people. So most of the time, if we can take care of the diet and also the gut health, and sleep well, stress,
skincare.
yes, yeah. A lot of parents will ask, is it not enough drinking water causing the acne breakout? Is it not enough sleep, sleep late? It is related. It is definitely related.
Part of it.
Yeah.
Yes.
So if you understand the physiology behind, now you know this is not because sometimes the mother nagging on the children. It's not really, it's actually the facts that it is related. So that's why if possibly, yeah, if you yeah, facing acne problem, okay, try to get these things right. Yeah, then do as what you can do in your lifestyle. Definitely you will understand and take care of your acne easier. Unless your acne is more severe, aggressive pattern, then those things that you have tried is still not possibly or not really reaching a good stabilization of acne, then our roles can come in as our intervention, some intervening treatment, medication. Sometimes we need to use some antibiotics. Yeah, sometimes we need to use some other oil control medication. Yeah, so there are plenty of treatment available. Most importantly, the factors to consider is whether you are on the risk of scarring. Yeah, ultimately the goal, the aim point is whenever you have acne issue during whatever age you are, 12 years old, 14 years old, 16 years old, 18 years old, what we need to make sure you are, doing right is preventing the scars. If you are having those factors as what we mentioned just now, if you have, again, maybe you can repeat again, what are factors that causing scars, yeah, the risk of scarring, yeah, that is what you need to really pay more attention to your acne treatments. Yeah, maybe Dr. Mesa can repeat again what are the factors.
Okay, so the first one would be severe acne involving those very large congested pustules. And number two would be the location, especially at the temple, forehead, the bilateral cheeks. And number three will be those the location or the widespread of the acne.
Yeah, very nearby each other, very congested.
Very congested
yeah.
ones.
And it sometimes involve acne breakout on the chest and the back.
Yes.
Okay. So you are on the higher risk of scarring.
Yes.
Okay. What else? Failed products.
Failed
facial
using
treatment.
harsh chemicals.
Okay.
Yes.
Sometimes,
extractions.
Yeah. Overdone treatment can really weaken the skin. Okay.
Yeah.
And
I do really have a lot of patients coming in because of acne scar due to extractions, because they thought that extraction is the only way to get rid of the acne.
Indeed, it's not.
Yes.
It's actually
Never.
It's not helping the acne, but indeed it's actually pushing the acne's character towards higher risk of scarring.
Yes.
Higher risk of scarring, or if you do extraction. If you don't spend any money with extraction, probably your scar risk is high, but not as high as those compared to those who are doing extraction.
So also avoid touching, and also extracting the pimple on your own at home, besides going to a therapist.
Yeah, I think this is also an important concerns. People will say, hey, is it because of dirty? The
Yes.
pillowcase is dirty, or maybe the hand is dirty, keep on touching. And these are the factors causing the acne couldn't be cured. And it just keep on coming back. Is it right? Or partially right or wrong?
It's actually part of it partially right. Okay, so when you touch or picking at your acne, it can actually increase the risk of infection.
Okay.
Yes, especially bacterial infection, as our skin is actually filled with good and bad bacteria. So if you keep touching, especially when your hands are not clean, it can actually increase the risk of infection over the acne. So once the acne become infected, that means it will have pustule, then it will become bigger and it can live on scar more easily. Yes.
So the understanding is, if you already have acne, means comedons, blackheads, whiteheads, most of the time at this condition, you will feel itchy, you will feel that you got something on your skin. So sometimes unconsciously, subconsciously, you can't even realize by yourself, you feel that itchy, then your hand is just like self-moving towards the skin and you want to,
Involuntarily.
you want to touch it. Yeah. So sometimes even though the pillowcase is clean, but because your skin is oily character, definitely when you sleep on it, your oil will stain on the pillowcase and it will create a kind of like feeling that the dirtiness of pillowcase aggravating your acne. So the fundamental here to get it right is, if your skin is already sort of showing the oily characters, then this picking, this pillowcase factor will come in as a triggering, as a aggravating to cause more infection to come in. But if your skin is not having oily character, even though you sleep on a very dirty pillowcase, you may get infection, but it's not acne, but it's other things, maybe some folliculitis or some furuncle kind of carbuncle thingy, which is the infection on the other part of your skin, not oil glands. So these are the things. So if you are having this acne, the priority is to take care of your oil character by balancing your skin oil and protection, which we just mentioned earlier on the skin care, to make sure your skin is well balanced. And of course, if possible, try to reduce conscious picking,
touching,
and take care of hygiene is a good practice to reduce the aggravation, but it's not cure. Even though you do all this, you still feel that, hey, why my acne is still picking out? It's not your wrong. The acne itself is there. Even though you take care, you cut your nails, you clean your face, you don't even touch your face, then you change your pillowcase one day, 2 times lah. You still break out. It's not your fault, because
your skin character is oily itself.
Yeah. So these are the aggravating factors. You're just reducing the aggravating factors. But the good part is, if you practice good hygiene, it reduces the breakout infection. Means your acne doesn't have a lot of infection, then the severity of your acne become lesser. Because we know when your acne break out and get infected and more severe inflammation kicks in, the damage is bigger, the damage is deeper, then the scar risk is higher. So ultimately, if you are looking at scars, definitely this is important, to take care of your hygiene, don't pick it, take care of your hygiene. But it's not a method to cure, it's just preventing from worsening. All right?
Yes, Dr. Jeff. So just now we discussed about acne affecting teenagers, adolescents. How about those who have acne after 20 years old? That means after the age of the peak age.
Okay, as what we mentioned just now, those girls who have PCOS, which has underlying insulin resistance and estrogen sensitivity, this group of girls are higher tendency to prolong and sustain their oily character of your skin even after their puberty ends at about 20 years old. Which means this character of hormone imbalance goes along and carry on after 20 years old. And sometimes we do notice this group of categories of people, they get an aggravation of this presentation of acne, means suddenly at around 25 years old or suddenly around 35 years old, yeah, they suddenly get a lot of acne breakouts all of a sudden, which probably during their younger age, they don't have acne as severe as now. Then they don't know, oh, suddenly what happened? Yeah. So this category of people who have acne after 20 years old, we call it adult acne. Actually, it is underlying hormonal trigger acne. Yeah. So the treatment strategy is a little bit different compared to teenager acne. So teenager acne usually we know that after some time it will settle by itself after the hormonal surge become stabilized. But what we need to do during teenager acne is to prevent
Scarring.
yeah, we need to take note if any possibility of risk of scarring, then we need to take action as early as possible, or else you just need to take care of your diet, your skincare, your sleep pattern, and try to keep a hygiene well. But then if it is adult acne, means acne after 20 years old, you may not be able to really get a full settlement of your acne, even you did all those. So you need to look into your hormonal surge. If your acne just all of a sudden surge out, then probably something happened in your body that triggers up the acne, usually related to your unhealthy guts or insulin resistant or inflammation characters in the body. So that can be tackled by some intervention of medical treatment. So we can do a blood test, we can do some assessment on your gut health, then some supplementation, some nutrition, can help you to reduce the inflammation in the body, can help you to improve your gut health, and also reduce the insulin resistance. Yeah. If it is very severe and the acne has already been breaking out quite severe, then you can come with some medication intervention for a short period of time to calm down the oil gland, while at the same time you improve your inflammation in the body and improve your gut health. Most of the time, if you manage it in the early form and in the right timing and right duration, a lot of people will get a good stabilization of their adult acne as well. Right? So this is adult acne. In men, it happens also. In men, about 15%. Okay, and most of the time we know men, of course, men doesn't have PCOS. Okay, but men also have this insulin resistant character. And most of the time, if those people who have severe acne, means during 16, 18 years old, when they are having teenager acne, if they miss that period to treat well on their acne, the scar has formed. And once the scars form, it actually makes your oil glands damaged, distorted. Yeah, the function become more stubborn. So after 20 years old, even though your hormonal surge become more stable, lesser, but the structure of your oil gland become damaged. So after 20 years old, you will still have a lot of oily character on your skin, a lot of this congestion and breakout. It's because the oil gland has been damaged. So the treatment strategy here for this character is usually have to recover the scar at the same time together to have a strategy to reduce the oil gland. Because what we do notice a lot of people don't really realize is they try to target their scar only without treating their oil glands. And some of this group people, they realize that they need to target oil gland. But then if they target oil gland alone without targeting the scar, it also doesn't hit to the best outcome or result because the oil gland are being damaged and blended into the scar. So the treatment has to tackle both sides together simultaneously. The oil glands reduction and the scar treatment, the softening, the resolution of the scar. Then only the skin can really goes back, improve to the healthier level, stabilize in a healthier level, and simultaneously have a better sort of stabilization. We can say almost cure of their oil gland characters if they do it in a proper manner. So all these are within our scope of treatment for our acne patient. Yeah, you see, acne doesn't present as one kind. Acne means acne. Nothing. It's actually no. Yes, acne means acne, but there are multiple different variation. Yeah, female teenagers at 12 years old, there are some consideration. 12 years old, 15 years old, male teenager, there are some consideration. 18 years old, 20 years old, female, there are some consideration. And 20 years old, 18 years old man, of boy. So some different consideration into this different characteristic of acne have to put into consideration when we are treating the acne. And goes on like 20 years old above female, hormonal acne character, scars, triggered, stubborn, resistant acne. So all these are the variation of acne. So if you are listening to our live talk today and you are not sure which kind of
Acne
acne you are having, so you can always contact us for further assessment, further details to get your skin problem right first before you start on any treatment plan that you are planning to do. Whatever products you're planning to buy, whatever treatment you're planning to do, even scar treatment also. Before you plan, let's get your skin characteristic diagnosed or confirmed. At least you know what you're doing is really going to work. Or else you may not know, you are like gambling, you are like trying.
Try and error.
Okay, so acne looks simple, yet is a lot of consideration also. So these are our sharing based on a lot of study, research, a lot of experience from our patients, and multiple angled consideration of this treatment plan, as well as considering integrating a lot of this, we call it functional way of treating acne, especially from the hormonal side and nutritional side. So this give a wider scope of variations, kind of treatment options to suits different characteristic of
Different
acne,
groups of
different group of clients,
acne
patients.
patients.
So these are our treatment variation that we have. All right. So, Dr. Mesa, how you want to?
And so in summary, actually, just to share with you guys, to repeat again, so how can we choose the right products for acne or acne-prone skin? So again, non-comedogenic, okay, and then water-based, oil-free, okay, at least what Dr. Jeff mentioned, a cleanser, a toner, moisturizer, sunblock. And then eat well, sleep well, maintains hydration, and then take good care of your stress management. That will be very important if you want to maintain the stabilization of your skin. Yes.
Yeah. So after you did everything, okay, get yourself assessed by seeing whether you have this risk of scarring factors or not. First, if your acne are very bumpy, big one, a lot of pus, a lot of bulky, or if your acne are very congested to each other, very nearby, or it involve a wider area up to your chest,
Back.
and if you are younger than 16 years old, even your acne started as early as 12 years old, 13 years old, and if you have been doing extraction and your skincare have been doing for some time and it doesn't really help you to stabilize your acne well and still popping out, these are the factors or conditions that you can self-assess whether are you having. If you are having, means you are on the risk of scarring. Okay, so if you are on the risk of scarring, please don't wait further. Don't continue whatever you are doing, even though those whatever you are doing is what Dr. Melissa mentioned, but it's still not working for you.
Yes.
So you need some treatment advice, from doctors to further stabilize your acne in a better way to ultimately prevent scars.
Yes, to reach out to the professionals to actually tackle the problem more effectively.
Yes.
Yes, because there are those severe acne which you can't manage on your own with just skincare or facials. So you still need some interventions from professionals, especially as early as possible at the early stage, because our aim is to prevent scarring, like what Dr. Jeff mentioned, because it can live on actually more. Besides physical disfigurement, it can also cause psychological distress to our clients.
Yes. Let's give our children, our next younger generation, a more beautiful skin. By knowing how to taking care of their acne well, and giving them a good solution in their early age whenever possible.
Yes.
All right. So wish everyone having a beautiful skin.
Yes. Okay.
All
so
right.
have a nice day,
Thank you.
everyone. Thank you.
Bye-bye.
Bye bye.